Okay, good evening. This is Mary Sue Lanigan with Michigan Parkinson Foundation. I am delighted that you all were able to join us. I see lots of familiar faces tonight. I think we've got a speaker who is really well known on the national level. We've had so many people tell me that I need to recruit Dr. Laurie Mischley to speak about all types of topics, but specifically nutrition and Parkinson's. It's always a hot topic. So tonight, Dr. Mischley is joining us, and she's going to be talking about healthy lifestyle and daily decisions and PD progression. So I give you over to Dr. Mischley. A few housekeeping notes. I have muted all of you. If you have a question, please enter it into the chat box or wait until her presentation is done, and then you can unmute yourself and ask the question, okay? If for some reason you become unmuted, please pay attention and mute yourself, okay? All right, Dr. Mischley.
Great. So thank you very much for this invitation. It actually means a ton to me to be speaking to my hometown group, right? I grew up in Alpena, Michigan, and before we got started with today's talk, there was a question about what is a naturopathic doctor. And so I'm going to take a minute or two and just kind of tell you a little bit of the backstory about how I got here, because you in Michigan don't have access to the type of medical care that folks in Washington have access to. So while I was studying pre-med at Alpena Community College, I was on my way to University of Michigan and learned about this guy named Linus Pauling. He is the only person in history to win 2 unshared Nobel Prizes. And his opinion was that neurologic diseases and psychiatric diseases were actually nutritional deficiency syndromes. And I got really smitten with this 80-year-old guy who was kind of considered a radical in the field, who was saying that nutritional neurology problems were actually due to nutrition. So University of Michigan didn't have a nutrition program. I became pretty obsessed with nutrition. I went to Penn State because they had this great program, and I was still planning on going to conventional medical school, but nutrition wasn't really considered a science, right? It was really clear to me as I was going to conventional medical school that I would just have to shelf all of my interest in the role nutrition plays in brain health. So I found a naturopathic medical school here in Seattle, Washington. It's called Bastyr, and it is a 4-year medical school. The first 2 years are pretty much identical to all other medical schools, MD, DO. The last 2 years are a lot more eclectic, right? You know, we learn herbs and physical medicine and counseling and Ayurvedic medicine and traditional Chinese medicine and chiropractic adjustments and pharmaceutical prescribing and minor surgery. And so it's kind of a jack of all trades, master of none, but it's a clinical doctorate in holistic integrative care. It's kind of, you know, and so they had a very strong nutrition program as part of their medical school training. And here in the state of Washington, I'm contracted with Blue Cross Blue Shield and Uniform and United. I contract with the insurance companies just like any MD or DO. I write prescriptions just like any MD or DO. And my entire clinic for the last 10, 20 years now has been Parkinson's exclusively for the last 10 years. But I function a lot like your Parkinson's docs would, but I'm a holistic integrative naturopathic doc. 10 years into my practice, I got a grant from the government to leave practice and go into research. And that's when I got a master's degree in epidemiology and a PhD in nutrition science. And so and for those, I studied lithium deficiency in Parkinson's disease and glutathione deficiency in Parkinson's. So that's kind of the academic background and how I got here, but that long-winded story is to kind of explain and plead to you. I would love to someday move back to Michigan. And right now, because Michigan does not license naturopathic doctors, I would have to call myself a health coach. I couldn't write prescriptions anymore. I couldn't contract with insurance companies. I couldn't order laboratory tests. And so here in Washington, I have this full, great clinical practice, and it's not even an option for me to bring this type of medicine home. So if there are bills should be coming up in the next couple of years and you have an opportunity to talk to your docs or legislatively get involved, this is only going to help you to expand the type of care that is available in Michigan. So my disclosures will be on the website. Some of the stuff I'll point it out as we go, but big picture, before I get started, I just want to say a lot of people take a lot of things for Parkinson's. And I don't want you to fall into this idea that there's one way to treat Parkinson's. Some things are going to slow progression. Some things are going to treat your symptoms. There might be something that actually helps your constipation, but makes your disease progress faster. And so I'm going to avoid over the course of this talk, just throwing a bunch of information at you for stuff that is good for Parkinson's. I'm going to try to be really clear on the goal. I'll tell you when something tends to help the symptoms, and I'll tell you when it looks like it might slow progression. Because frankly, if you're 100 years old right now and you're watching this talk, I would tell you don't worry too much about slowing progression. You're not going to be around in 10, 20 years to really appreciate the benefits. If you are 40 or 50 or 60, and there is a good chance that you are going to be alive in 10, 20 years, I will tell you it is especially important for you to focus on the strategies targeting slowing progression. This is what symptom management looks like. So that all of these dots are real people, and the higher the number, the more symptoms a person with Parkinson's has. And what you can see is as time goes on, people's symptoms tend to get worse. Most people get worse at about 40 points per year. And right around year 10, they start to say, you know, I'm noticing my quality of life going from good to fair. A symptomatic drug is going to bring that whole line down. It doesn't change the rate at which you progress, but it slows the symptoms each step of the way. This is new data that no patients have ever seen. I'm going to be presenting it later on this fall to the Parkinson's community. But what we did is we looked at 439 people before and after they started levodopa. And this is super exciting. Talk about symptom management. Levodopa does not just improve tremor or motor symptoms. We saw the biggest improvements after somebody starts levodopa in anxiety, muscle pain, sleep, motivation. And so, you know, this is an example of something. Levodopa does not slow Parkinson's progression at all. We've looked. It doesn't speed it up. It doesn't slow it down. It doesn't do anything to change the rate at which this disease progresses. But it does a really good job hiding your symptoms each step of the way. And so I guess before we walk away from this slide, one of the things I just want to communicate is I see a lot of people who are nervous about meds. They have some medication hesitancy. They have this idea that you should hold off on levodopa for as long as possible. And I would just encourage you to be a little flexible with that thinking. I think that these data really suggest that there's way more benefit than people realize, that we have been underestimating the improvements that levodopa might have for people as far as anxiety, muscle pain, sleep, motivation, and a lot of these non-motor symptoms that many of you complain about. As opposed to slowing progression, this is really what I'm excited about. We have known about, you know, Parkinson's disease. We have been over 200 years now. We have been trying to slow the slope of progression. And we do not have a single FDA-approved drug that does it. There isn't a surgery that does it. In 200 years, the closest we've come to anything that looks like it might slow the progression seems to be exercise, sleep, and probably diet. And we'll go through those data today. Ideally, the more you slow the slope, the greater the impact. But I want you to see the earlier you get started, the more potent any of these interventions is. Right? The most important thing I'm communicating here today is where slope is where the goal is to decrease slope. The single most important thing that you can do is get started early. So about 7 years ago, I started this study called CAM Care in PD. Please, 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 if you are not already enrolled, consider joining this study. The more of you who participate, the more honestly accurate the data becomes. If you want to be represented by these data that I'm about to present, this is your chance to tell us your story to make sure that people like you are represented. So it takes about an hour twice a year. We send you a survey and you answer a whole bunch of questions. And we now have 2,600 people that we have been sending surveys to every 6 months for the last 7 years. And we've collected a whole bunch of data, and we can now tell you who are the fast progressors. Let me show. We can now tell you who are the people who are progressing really fast and what are they doing differently than the people who aren't progressing at all. So what we're doing to get your score, just so you understand what the outcome measure here is the propd.org is a Parkinson's disease severity rating system. You can go there, and for free, you can slide the slider bars to fit your symptoms and get your ProPD score. It takes about 5 minutes. And this is what we're using to determine how well someone is doing. And so there are 33 different symptoms of Parkinson's. There's depression, anxiety, fatigue, tremor, REM sleep behavior disorder, restless leg syndrome, all these common symptoms of Parkinson's, motor and non-motor. And if you don't have the symptom at all, you click over here on the left. If you have it a little bit, somewhere in the middle, and if it's as bad as you can imagine, you click over to the right. And so the patient just goes through and rates each one of their symptoms. Big picture, can we all agree that if a person's score is 0, we're happy, right? The closer we get to 0, the happier everyone is. If you go through this list and you say, I don't have a tremor, constipation is no problem, I move with ease, no problem with erections, no urinary symptoms, I sleep great. If you can go down this list and give all of these a low score, we're good. So that was the scale that we built. And so the list that I'm going to give you are basically, we took a slice. We took everybody the day they joined the study, and we looked at who are the people who are doing the best and what are they doing differently than the people who seem to be progressing really quickly. And we have taken into account, when I show you these data, we are comparing people to people just like you. If you are a 67-year-old woman who makes $40,000 to $60,000 a year, and your same level of age, we adjust based on age, income, education, years since diagnosis, and gender. So we tried to compare apples to apples so that we could really kind of narrow down to what are the decisions you make over the course of a day that might be shaping whether this disease is progressing faster or slower. So before I move forward with the answer key, I'd really like to talk just about reframing for a minute and having an open mind, right? Like, we all have our biases. Food is so much more than just a way to give our bodies calories. It is cultural, it is a habit. We eat when we're celebrating, we eat when we're depressed, we eat for pleasure, we eat when we're in pain. I mean, we use food for a lot of different reasons, and it's a hard thing to change. Behavior modification is actually really, really, really difficult. And so when I talk to people about, hey, broccoli is good for you, nobody acts surprised about those data. As soon as I tell them ice cream seems to be bad for them, no one trusts the data anymore. And so it doesn't really matter if you like the food or don't like the food, or if you want to give it up or you're willing to or not. I mean, it's not about what I think. It's not about what you would prefer. I'm just here to tell you, when we surveyed a couple thousand people with Parkinson's, the people who are doing best are clearly living a different lifestyle than the people who are doing the worst. So we don't know if you change your behavior, will it change your outcome? If you stop eating cheeseburgers and milkshakes and start eating salmon and green beans, will it change the progression of your disease? We don't know. We actually do. I just got those data last night, but I'm not ready to present them yet. But by the end of this year, I hope to present and publish data that says that we do know that if you change your behavior, it will change the slope of progression. So, I want to also, when we talk about Parkinson's symptoms a little bit, I want to make sure that we give some attention to the non-motor symptoms of Parkinson's disease. We surveyed all these folks with Parkinson's and asked all of you to rate your symptoms. And we talk about Parkinson's like a motor disease, but it actually, if you look at the most common symptoms that were reported by people with Parkinson's, fatigue, handwriting, loss of smell, memory impairment, muscle pain, those were more common symptoms than the motor symptoms that define Parkinson's. And so it is hard to talk about Parkinson's when the pharmaceutical drug manufacturers, the researchers, a lot of the doctors are giving so much attention to motor functions. But when we survey patients, what you're really complaining of primarily are the non-motor symptoms. You know, obviously they're both really, really important, but I feel like we haven't done justice to the non-motor aspects of disease. And that's where nutrition is going to really play a role. When we combined all of the symptoms that we're studying, 2/3 of the symptoms of Parkinson's disease fell under the non-motor Parkinson's category. So I know that the tremors, what you see, some of you get self-conscious by it. It's what other people notice and ask you about, like the outward world sees the motor symptoms. But I would actually argue this disease is at least, if not more, a disease of non-motor symptoms. I'm doing a study at University of Washington right now, and we're looking at how well your muscles, the mitochondria inside your muscles produce energy. And we can see that muscles in Parkinson's aren't producing energy the way that they should be. This isn't just a brain disease. This is a whole body disease, and it affects how your muscles perform, your gut, your so many things beyond that small motor part of your brain. So we'll start with exercise because this is really, there is a body of literature that kind of supports this. We're not the first people to report improvement with exercise, but what we saw was the more days per week that a person exercised, the higher they rated their quality of life. Not really a big surprise, but what I was a little bit surprised to see is down at the bottom, we asked how many days per week. The first 2 days seem to not count at all. When we compared to people who don't exercise at all, even there was a little bit of a trend towards improvement, there really was not a statistically significant improvement in Parkinson's symptoms when people only exercised 30 minutes 1 to 2 days a week. That's just not enough to pack a punch. You start to see measurable improvement at 3 days a week. 4 is better than 3, 5 is better than 4. And what we see all the way up, the more days per week that you do at least 30 minutes a day of exercise, the better people, the fewer Parkinson's symptoms people reported. We can come back to this maybe in the question and answer session, but in my clinic, for when a patient is trying to decide what type of exercise to do, I mean, rock steady boxing is excellent, yoga is excellent. I mean, there are a lot of options out there. My checklist, what I encourage people to do is find exercises that are physically intense, cognitively challenging, outside your comfort zone, and so difficult that you're getting frustrated and making mistakes. You want to be getting jumbled up. You want to be getting frustrated. That's when your brain responds by making growth factor. If you go to a tango class and you start turning the wrong direction and stepping on people's feet and can't keep a beat, you're going to get nervous. You're going to your brain starts racing, trying to remember the steps. I mean, you're checking a lot of those boxes. It's physical, it's cognitive, there's some peer pressure, you're getting frustrated, and you can have fun with it. But those are the types of activities where we see the greatest benefit is when you're actually pushing yourself outside what is comfortable to you. We see, this slide just shows that we see with 3 days a week of exercise per day, we see improvements about equally in the motor and non-motor symptoms. It's not just the motor symptoms that improve, it's the non-motor symptoms that improve. And this is even more of a fun slide. So what we did is we looked at which symptoms actually get better with exercise. And again, the blue line are people who don't exercise at all. This orange line are people who do 1 to 2 days a week of exercise. No difference, right? If you're doing 2 days a week of exercise, you have about the same level of fatigue and sleep problems and anxiety and depression and motivation and cognitive stuff as someone who is doing no exercise at all. When you go down to 3 days, up to 3 to 5 days a week, that's a pretty hearty improvement in all of those non-motor symptoms. And if you get up to 6 or 7 days a week, it's even more robust. So that people who are exercising 6 to 7 days a week are about half as symptomatic as people who exercise 2 days a week or less. I don't know if you can do a poll here, but I'm curious how many days per week the average person watching this is doing their 30 minutes of exercise. You know, and the next slide actually asks that question. You know, so all of you have to decide how bad do you want it. You know, it's the way an alcoholic just can't drink anymore. I feel like people with Parkinson's need to kind of, I just don't have a choice. I might not like to exercise, but I don't have a choice. I have to. My symptoms are twice as bad if I don't. So part of my daily routine is get up, I brush my teeth, I use the bathroom, and I get my 30 minutes in. I mean, you need to find some way to make it something that your body, it's just part of the routine, because it really does seem to be absolutely essential for health and well-being. It would be hard to feel well if you weren't an exerciser. So this is pretty eye-opening. You know, being lonely is as bad for you as 7 days a week of exercise is good for you. That to me is pretty profound. You know, nutrition is not just food. Nutrients is anything that nourishes us. And I am personally kind of fascinated that, you know, you get your vitamin D from sunlight, and there's something you get from other people. You know, we are a tribe, we are a community, and everyone needs to be needed. They need to be plugged into a larger community. And when you isolate people and they feel lonely, they get worse. Everything gets worse. And you can be happily married in a good relationship and still feel lonely, right? Like you can be surrounded by loved ones and still really not feel like anyone hears you, gets it. And you can be completely isolated and not be lonely, right? The way we asked this question was, I feel lonely, true or false? Right. And what we saw is that the people who said true were almost twice as symptomatic as people who said false.
I can't hear. I have to.
Can you hear me?
Oh, you have to mute yourself.
We can hear you, Dr. Mischley. I'm going to people that we're hearing some background from.
They're working on it.
You have to mute yourself.
You can mute yourself, folks.
There we go. Okay, we're good? All right, and my son just passed his driver's test, so.
Oh, good.
All right.
Congratulations.
95%. So, you know, the medicine that providers recommend is so much bigger than just a pill or a surgical procedure. There are actually, there's this whole field evolving called social prescribing that really brings physicians more involved in patients' personal lives and helps them plug in to a larger network. I do think Alcoholics Anonymous is a fabulous model. I mean, it's the only one I can think of where coming together as a community is part of the medicine. There is something about the brotherhood, the sisterhood, the tribe that keeps people healthy. And I think we're seeing something like that happening in Parkinson's disease too. The yoga for Parkinson's, the power for Parkinson's, the rock steady boxing. It's not just the boxing, it's that other people with Parkinson's are coming together to do it with you. And there's something about that that seems actually to translate to improvements over time. When we study loneliness a little bit deeper, right? We start asking what makes somebody lonely, what contributes to loneliness. If there were one question that we could screen for that looks like it might actually predict who's lonely and who's not, is when people say that they often or sometimes feel left out. The more often somebody feels left out, that is the single marker that seems to ring most true for loneliness. So I bring this up to you because I want you to take your own inventory. I mean, I think it's really easy to go through your day not recognizing how lonely you are, and realize that there are a lot of different types of loneliness, I mean, and social connection. And just because you have somebody around you all the time doesn't necessarily mean that those needs are being met. And I also think that everyone watching this video is in a position to be a part of the solution. I mean, everyone watching this video can reach out to somebody else with Parkinson's disease and see if you can't make them feel less left out. I mean, that might translate to medicine. What we're seeing in the research is that there are a whole bunch of these non-motor symptoms that are associated with malnutrition, right? And so that my PhD is in malnutrition, in nutrition. This is what I am personally most interested in. And the question I obviously get the most is, what role does diet play? As I've already said, we don't actually have enough data that I could promise you if you start eating differently tomorrow that it will change how your disease progresses. We do have enough data to say with tremendous confidence the people who aren't progressing are making different dietary decisions than the people fast progressing. I personally don't recommend waiting for more data to come in. For any of you who want to read the backstory, the methods section, these data were published a couple years ago. You can find them online. You can go back to this slide, but what I'm about to show you is the new data, this exact analysis, but updated. This website, livinghealthywithparkinsons.com, is where we dump all of the research. Like every year we're going to update this. This is where you're going to find the answer key. So this is last year's 2020 analysis, and this is what 2021 looks like. So I'm just going to read through these. It's a little tedious, but I just want you to kind of, these are the true false questions that we asked people. And what we saw is that the people who said, who after comparing them to other people just like them, same age, gender, diagnosed the exact same time in the same income bracket, when all those things were compared, the people who were doing best avoided artificial sweeteners, soda, they avoided beef, pork, they eat most of their meals at home and regularly cook most of their own meals and even eat meals for others. I routinely plan meals for others. They avoid artificial flavors and colors, avoiding dairy, eating a lot of farro. We'll talk about that in a minute. People who try to eat organically grown foods when possible tend to be doing better than people who don't try to eat organic. And notice the word is try. Doesn't mean you have to all the time. It means that you make the effort. People who identify as vegetarian are doing a little bit better. Quinoa and spices all seem to be common things among the people doing unusually well. Among the people who are doing unusually poorly, they are drinking most of their water is coming from plastic bottles. They are overweight. They have difficulty affording healthy food and groceries. And I do want to just take a minute to talk about the financial part of that. You know, I just don't know how to fix that. I can talk to all of you about how to get more quinoa and vegetables into your body, right? I see a way to fix that. But it is, of all of the data that we are looking at, being lonely, being financially in a low income bracket, getting a bad night's sleep are the three worst things that you could do in terms of Parkinson's disease progression. And that is a bigger conversation than what I know how, you know, I can't propose a solution for that here, but I think as a community, we have to start having that conversation. That I can't put my finger on the how or why. Maybe it's just people in lower income brackets don't have as good of access to movement disorder specialists or some of the better medications. I mean, it could be an access thing. It could be that poverty leaves you in a constant state of stress, and that eats away at your nervous system and make things worse. But I just think that when I started this study, I wasn't prepared for how much poverty was associated with worse symptoms across the board. So here is the new 2021 data set that very few people have seen. The foods associated with the slowest progression, the best outcomes over time, are up here at the top. Farro was the big winner. You saw it on the last list. Farro, sorghum, buckwheat, quinoa. We'll talk about those in a minute, but those are not foods I have normally been eating. I don't know how to cook them. I don't know what to make with them. Farro was not part of my Michigan diet growing up, right? Like it just wasn't something I've had a lot of exposure to, but it topped the charts. It was better than fruits and vegetables and anything else. But big picture, this is kind of a Mediterranean diet. This is kind of a, we call it vegan plus fish, plant-based plus fish, pescatarian. But the people doing best are eating the most farro, fresh vegetables, fresh fruit, nuts and seeds, olive oil, coconut oil, non-fried fish, beans, drinking green tea, wine. They're adding fresh herbs, that's the bottom of it, adding fresh herbs. And then the people who are doing the worst are eating canned fruits and canned vegetables were a surprise. I was not expecting to see that. When I designed this study, I expected that canned green beans weren't as good as fresh green beans, but I thought all green beans would be good. I was not expecting to see that anything coming out of a can is actually worse for you than not eating it at all. And so canned stuff seems to be associated with faster progression. Soda, both diet and non-diet. Dairy products are associated with Parkinson's. We have ice cream, milk, yogurt, butter, cheese is on here someplace, cheese. We have 5 studies now that say the more dairy you eat, the more likely you are to get Parkinson's disease. Our data very clearly says once diagnosed, the more dairy a person eats, the faster their disease progresses. And then most forms of meat, beef, chicken, and pork are on here, as is pasta. Juice was a little bit of a surprise. Fried foods, those are on the bad list. So you can do, I'm going to share these slides. You can take a screenshot of this. You can hang it on your refrigerator. What I have been doing for people, I'll show you what I've just created for my patients in a minute. Just to show you what farro is, it's this Italian grain. It's a type of wheat. And so it appears that some of these grains that are coming up really good on our list that I just showed you are associated, they have a high amount of a special type of fiber that feeds all the good bugs in your large intestine. Basically, they're called fermentable fibers. And there's something about these grains like sorghum, buckwheat, farro that have a special fiber that is especially good for growing the good bacteria in your gut. So I started doing some internet searches to try and figure out what farro is. I've been using it actually quite a bit in the last month or two. I like it. I mean, if I can use the word meaty to describe a grain, I would probably describe it as a very meaty grain. I like adding it to soups and salads. It actually gives it some real texture. It's more filling. I like the taste more than I like rice or wheat, actually. So this has actually been a good thing for me to learn about. But I just started Googling recipes for how I could start to use more farro in my life. I've been making like a mushroom barley soup, but mushroom farro. It's been good. You can have a breakfast that looks great. Okay, so those are just kind of to give you some ideas of what food might look like, trying to incorporate some of those grains. And so what I just put together just to kind of help people understand that different cheating, or the good side and the bad side is weighted a little bit differently. I put together a point system so that people could just not to get obsessive about this, not to be real strict with this, just to take your own inventory and see how you're doing. We don't know why, but it looks like the more positive points a person gets, the less progressive their disease. The more negative points a person gets, the faster their disease progresses. I'm just the messenger. This isn't my idea. This is when I surveyed 2,600 people with Parkinson's, the people who are doing the best never eat the stuff on the bottom and they eat tons of the stuff on top. The people doing the worst are eating lots of stuff from the bottom and not eating any stuff on top. So until we have a cure, my recommendation for all of you is go hang out with the successful people. You know, find the people who have the same disease you are. They seem to have a not very progressive disease. They say that their quality of life is high and their symptoms are low, and you should just do what they're doing, right? That's the best we can do right now, is find the people who are very successfully navigating Parkinson's and follow their lead. Nobody argues with my fruits, veggies, nuts and seeds, wine recommendation, ever. Nobody ever kicks and screams when I tell them they should eat. They say, duh. How many years did you waste trying to learn that fruits and vegetables are good for us? I mean, everyone believes the data associated with slower progression. People do not like it when I start telling them that meat and dairy are associated with faster progression, right? I don't know why. And it's not just my research. For 30 years now, we have been doing research. The Nurses' Health Study, Physician Follow-Up Study, Honolulu Heart Study, the Greek EPIC Study. There are hundreds of thousands of people now who have been followed in many different countries. And every study that has looked has found that when we ask, is there something in our environment that could be causing Parkinson's? All the studies that have looked have identified dairy. The more dairy you eat, the more likely you are to get Parkinson's. And then my data says, the more dairy you eat, the faster it progresses. Everyone in the question and answer session, there's almost always somebody asking for a loophole. What if it's grass-fed? What if it's organic? What if it's goat milk? What if it's camel milk? What if it's, you know, people don't want to give up the stuff that they like. And I don't know the answer to, can I cheat? What about a little bit? What if it's organic? We just don't have enough data to answer those questions. If more of you join this study, we might get enough data to be able to answer those questions, number one. And number two, in the meantime, I would say give up mammalian breast milk and switch to one of the 43 alternatives that is now available. Soy, almond, cashew, hemp, rice, the almond, the list goes on and on and on. For those of you who want a deeper dive into the diet conversation, I teach this online Parkinson's school. And if you go to the website at the top, I gave the coupon Michigan will get you a free pass to, 3 or 4 hours of diet food conversation where I talk about why do I think canned stuff is bad and what about organic chicken. And I kind of have much, much deeper, longer conversations about all the dairy stuff, all the diet stuff, but it's hours and hours of stuff that you can, for those who want to learn a little bit more about this, you can go to that later and kind of hear the full story. But this is kind of what the comparisons look like across all studies. I'm not the only person who's doing research on nutrition and Parkinson's disease. There are a couple other people who are interested in this. They're doing it from different angles in a different way. But there are really 4 diets that have been shown to have some promise, something to offer Parkinson's disease. The Parkinson Pro Diet is the one that I just talked to you about. That's what I'm calling the one that is based on patient-reported outcomes. The Mediterranean diet, the MIND diet, is a lot like the Mediterranean diet, only a little more focused on green leafy vegetables. It's kind of designed more for Alzheimer's, but based on a combination of the Mediterranean diet and a high blood pressure diet. But that looks to be very promising in Parkinson's disease. And then a ketogenic diet is where you basically run off fat. You avoid all carbohydrates. And you do a high fat diet, little teeny bit of protein, a little bit of carbohydrate. There's a study that showed short term it made people's non-motor symptoms quite a bit better. But frankly, it's a very restrictive diet. People start losing weight. It's hard to maintain. It's actually pretty stressful. And most people do not sustain it It's just not a very sustainable diet, and it actually increases your risk of malnutrition. So I don't routinely recommend the ketogenic diet. But you can see in those top three, the Parkinson Pro Diet, Mediterranean Mind, there's a lot of overlap. You know, when we start asking the question, is there a Parkinson's diet? It's starting to come into focus. I mean, all of us, all of the researchers in different countries from different angles asking different questions about food, nutrition, and Parkinson's. We're seeing some themes. The more vegetables you eat, the better. The more fruit and nuts and seeds and seafood and olive oil and coconut oil and wine and whole grains and beans, the better. Right? It's not going to hurt to throw some fresh herbs and spices in there. If you can buy organic, great. If you can cook your own food, great. But there does look to be shaping up to be some version of a Parkinson's diet. And similarly, there are some themes in terms of the things that are causing problems. The more red meat, pork, chicken, dairy, fried food, and soda a person eats, the worse, the higher the risk of developing Parkinson's, or the faster the progression of disease. And I will also say, I think it might even be my next slide. I'll talk to you in a minute. So what I just want to say here too is I'm, for the fourth time, I'm just going to reiterate to the scientists and the naysayers who are sitting there crossing your arm. These data do not tell us that if you never eat another cheeseburger again and only eat wine and salmon and nuts and seeds from here on out, that things are necessarily going to get better. They might, but we don't know that based on what I'm looking at here. All we're telling you is that the people doing best seem to be eating those green foods versus the red ones. This is what I was going to say a second ago about starting early. Not just starting early for you. This dotted line is the day of diagnosis. Parkinson's disease has been progressing for 10, 20 years prior to your diagnosis of Parkinson's. By the time you are told that you have Parkinson's disease, you're pretty late to the party, right? This has been happening for a long time without you knowing it. And so when I say start early, like, you're already late, right? Get on it. You're like a 62, 58-year-old saying, I'd like to save for retirement, please. Great, but like, come on, that really should have started before. So we do what we can, right? But you're going to have to work harder because most of you are already in this zone someplace. For your children, you know, I'm training 2 dogs to detect Parkinson's disease. There are skin biopsies coming out where we're going to be able to start to detect it early. You know, people who lose their sense of smell, constipation early in life. There are a lot of symptoms that people are walking around with for years and years and years that are already Parkinson's. They already have this degenerative process and we're not catching it in time. Within the next year, it is going to be easier and easier and easier to detect Parkinsonism in people who haven't even developed a tremor yet. They haven't even developed motor symptoms yet. We are at the point where we can find people before they get diagnosed, so that they can start some of these changes. So for those of you who are living with family members or kids who are not gonna be on board with, you know, some of these dietary modifications I'm talking about, I'm gonna argue it's in their best interest too, to make, you know, everyone would do better to eat more fresh fruits, vegetables, nuts, seeds, fish, farro, you know, herbs and spices. So anyway, this is what we're working towards, being able to get to the patients really, really early on before you even develop symptoms. If you can start exercising every day, change your diet to a plant-based diet. I'm not vegetarian. I'm not vegan. I'm dairy-free, but I am not here to tell you all that you can't have any more meat or you have to give up all the things you like. You know, I'm here to try and bring some awareness that your decision about what to have for lunch might be affecting this disease more than most of you realize. The rule in our house is I don't buy it, I don't bring it home. But if I'm a guest at somebody's house, I shut up and eat whatever they serve me, When I go to Michigan, you would not ever know I studied nutrition, right? Because it's harder to eat this way in Michigan than it is in Seattle. But so, you know, when I travel, I all bets are off. I eat whatever I want. My discipline at home affords me some freedom to have fun and go out. So each one of you is going to have to pick, you know, how bad do you want it? Are you a C kind of person, a B kind of person? Are you going to be are you striving for the A plus? And the more disciplined you are, the more of these foods you eat, the more you exercise, we do seem to see that that translates to better outcomes over time. But not everybody wants to be an A plus. Some people might say B plus is good enough. So that's it. We'll just end there.
Thank you, Dr. Mischley. That was fast. A lot of great information. I know I learned a lot, and my guess is the questions are going to blow up in just a minute. Can you see the chat? Can you see it?
I can see the chat. Medical school, BASTYR is the name of the medical school that I went to in Seattle. There are 4 naturopathic medical schools in the country: Connecticut, Portland, Seattle, and Phoenix, and 2 in Canada. Yep, someone else did it. Thank you very much. Yeah, so if you're seeing some of these questions you want to read to me, or you want me to just read through?
One of the questions that came up quite often is, what about eggs? I saw that eggs are on the, pardon me?
Neutral. If they're not on the list, it's neutral. It doesn't hurt, it doesn't help. Oh,
okay. Oh, wine. Red wine or white wine, does it make a difference?
My joke is, if everybody who asked that question donated $5 to my study, it would be the most well-funded study out there. The most common question I ask, and we did not ask it for the first 5 years, and we're only 1 year into asking red versus white. So if you invite me back in a year or 2, we will have that answer if enough of you join the study.
Okay, lots of compliments. I'm trying to get to the questions.
Somebody asked a question about whether or not other forms of Parkinsonism can benefit from this. And the short answer is probably and yes. I mean, we don't even know what Parkinson is. We don't know where idiopathic Parkinson's disease stops and other forms of Parkinsonism begin. You know, it gets really blurry. And I would actually argue that there are a whole bunch of people who think they have idiopathic Parkinson's disease who actually probably have other forms of Parkinsonism. And when you Google other forms of Parkinsonism, you know, the lists that come up online are like, you know, Lewy body dementia, PSP, MSA. You start seeing those other Parkinsonian disorders, and those are very much other Parkinsonian disorders. But there are a whole bunch of forms of Parkinsonism that are often ignored, right? B12 deficiency causes Parkinsonism. You know, heavy metal toxicity, manganese toxicity causes Parkinsonism. Autoimmune disease can cause Parkinsonism. You know, there are pharmaceutical drug side effects can cause Parkinsonism. And so I think a lot of people get nervous when they start getting told maybe this isn't idiopathic Parkinson's disease, maybe this is another form of Parkinsonism. And I would just encourage you not to be nervous about that. Just roll up your sleeves and let's look a little harder to figure out why me? What is causing this? Because I actually think that some forms of Parkinsonism, you can actually find the cause and plug the hole in the bottom of the boat and live happily ever after. So just because it's another form of Parkinsonism sometimes means it's even more modifiable.
Here's a question. Protein interferes with my Parkinson medications. Typically, does plant protein interfere as much as an animal protein does?
Great question. So for those of you who don't know, levodopa is just an amino acid. And so if you have any amino acids, protein in your stomach, anywhere around the time that you take your meds, you are making your medication less effective. So what most people find is that the easiest, most effective thing they can do is save their dietary protein for the evening meal. eat a low protein breakfast, a low protein lunch, and have whatever protein you want with dinner. And that way your meds work great all day long. You know, you're going to be more stiff and more rigid after dinner, but for most people, they're just sitting around watching TV, reading a book. You know, they're not out playing tennis at 7 o'clock at night. That's a good time. If there has to be one period of the day when you're not quite so on, that tends to be a pretty good time to do it. So, but what you will find is you can sneak a little protein in during the day sometimes. And vegetarian protein absolutely interferes just as much as animal protein. However, it's much quicker. Have you ever eaten a salad and you're hungry an hour later? It's because vegetables, plant foods move through you a lot faster. Animal products, especially meat and dairy, tend to take 6 to 8 hours, where a thing of hummus might take 45 minutes. So the composition of the protein determines how long it hangs out in your gut. And I have people tell me if they have red meat for dinner, their meds don't work the next day. I mean, for some people, it sticks around a really, really long time.
Wow.
So all forms of protein will block it, but meat and dairy tend to block it for longer periods of time. Eggs too. People will tell me that 2 eggs for breakfast in the morning. I have a patient went 17 years. He went to 4 different neurologists and he kept saying levodopa doesn't help. But they could see just a little bit of improvement, but he never felt on. 17 years, 4 neurologists. Turns out for 17 years, he has had 2 eggs for breakfast and a turkey sandwich for lunch every day for 17 years. Just a creature of habit. And all he did was start having smoothies, stir-fried veggies and rice for lunch, save protein for dinner, and now he's on all day. I mean, it took 17 years for him to know what other people were talking about when they heard people say, I kicked on. And so for some people, they can be super, super sick. Golfers notice it the most, like the people who appreciate the protein thing. You know, golfers are quick to say that they notice an improvement. I don't know.
Okay.
They appreciate the fine control a little bit more maybe. But yes.
Okay. How can somebody get calcium without milk and milk products? What's a good source of calcium besides milk and milk products?
So while dairy products do have a lot of calcium in them, they also have something inside them that makes you pee out a lot of calcium. So it's actually very good marketing. I mean, it's not a lie to say there's a lot of calcium, but it's not like it really, the more milk any country consumes, the higher the rates of osteoporosis in that country. Like it is, even though milk has a lot of calcium, it is not true that milk is the solution to bone health. Low vitamin D is way more of a contributor to weak bones than low calcium. All of the dairy substitutes that we buy at home, you know, all the rice milk, soy milk, hemp milk, cashew milk, all has calcium fortified, is all calcium fortified natural. Almonds have a lot of calcium. Green leafy vegetables have a lot of calcium. I have really, really, really good seafood here in Seattle. I end up doing a lot of seaweed salads. Seaweed has a ton of calcium in it. But almonds, green leafy vegetables, tofu is packed in calcium carbonate. So that's a ton. But it is, and it's cheap and easy to get a calcium supplement if you really think you need one. But I actually do not worry too much about most of my patients' calcium levels.
What about the role of 3 in causing or increasing?
Right. Okay. What?
Wait, the role of what?
3, S-T-R-E-E. It's in the
S-T-R-E-E?
Maybe they spelled it wrong, maybe.
Stress.
Sorry.
Yeah, it's a problem. You know, we see that people who in the true false section, we asked a question, I practice stress management. And we can see that the people who said true are doing better, but but I don't know what that means. Like, I don't know how each of us were interpreting what it means to practice stress management. Is that mindfulness? Is that having a beer after work? Is that like putting on your headphones and listening to music? I mean, I don't know what stress management means to people. One project we're working on right now that I am really excited about is we know that the more high stress is associated with increased risk of developing Parkinson's, right? We've seen that in a couple of different studies. Anyone with Parkinson's can tell you that, mute all, and then I'm gonna unmute myself. Okay. And anyone with Parkinson's can tell you that stress will make their symptoms worse, right? We've even done a study that shows that medicines don't work as well when you're under a lot of stress. And so what we don't know is how best to decrease it, right? And here's honestly my honest answer to stress. I mean, obviously stress is bad, and learning how to control it and minimize it is good, right? But that not everyone knows how to do that. And what I will tell you is one of the things I'm really excited about in the community is there's a new tool that measures essentially stress. It's how well your autonomic nervous system, the agility, how well it handles what life throws at it. And it's called heart rate variability, HRV. And there are all kinds of tools. The one that I use is this Oura ring, O-U-R-A. I have an Oura ring, and I can measure every night. I wake up and I see what my HRV was last night when I slept. And it's basically a measure of how well your body is handling stress. And for somebody in our age group, we'll say 45 and up, normal is like 30 to 50. People with Parkinson's are almost all 20 or lower. Like, even before you, early in the disease, one of the first things to go is your body's ability to kind of manage stress. The analogy that I've been using, I don't know if it's a good one, but this vagus nerve that kind of controls how our body reacts to a lot of these situations has two tracks, a fight or flight and a rest and digest, sympathetic and parasympathetic. And they're constantly, it's like a teeter-totter that's just always going back and forth. And in Parkinson's, you guys get stuck. Like, you can't get your foot off the gas pedal. And Parkinson's, there's a Parkinson's personality. Parkinson's personality tends to be high achieving. They're very loyal. They're dutiful. They make sure that everything gets done really well. I mean, they might carry a little bit more stress just going through the day. They may make sure the corners of the towels are folded a little nicer together. I mean, it's just there's a lot that's been written about the Parkinson's personality. And I do think it's a group that tends to both maybe have a history of a little more stress and put a little more stress on themselves. And I don't think it's as trite as it sounds when I say really learning how to relax, like the way you would, if you took your leg out of a cast and it was all weak and atrophied and the muscle was smaller, you would go to physical therapy to rehab that leg. In Parkinson's disease, I think you really need to rehab the rest and digest part of your nervous system. The part of your nervous system that digests your food and keeps it moving through you, that calms you down, that part is out of shape. And you guys need to figure out a way to work a little harder to rehab your rest and digest parasympathetic part of your nervous system.
Sorry, I was muted. Thank you. I think we've got time for one more question. Which vitamin in the B family is the best to supplement for a Parkinson person?
The correct answer to that one is you measure your own levels in blood and urine, and based on your own laboratory tests, the answer for each person watching this is different, right? That's the correct answer. 20 years and a couple thousand patients in, I'm going to tell you sublingual B12. If you don't have access to a doc, you can't get your labs. If there is one B vitamin that is cheap and readily available and if you don't have it, could cause irreversible neurologic damage, but if you have it, could prevent progression. That would be the one, and it is probably the B vitamin that I see as most commonly deficient in my Parkinson's population. But I don't necessarily think every one of you should run out and start sublingual B12, but
Okay.
if I had to pick one B vitamin, that would be the one.
All right, one last question. Have you heard of a toxin in cashew nuts and that should not be eaten?
I don't know about that in particular. I'll tell you there are problems with everything. I mean, I could go through the grocery store with you and tell you why the kale is bad and the almonds are bad and the rice is bad. I mean, you know, we all have to pick our battles, you know, and really, and here's the other reason I like that point chart is because I also think it's a little bit of justification for me. I am really, really not good at never eating the stuff at the bottom of the list, right? But I am really good at loading up on the stuff at top. I can have a smoothie for breakfast that has 35 points, right? If I have an impressive breakfast, an impressive lunch, I don't actually feel too guilty if I lose a couple points at dinner, right? And so, you know, I think this is also designed for you all to kind of try and figure out what works for you. I mean, you can kind of take baby steps, and as long as you're better this year than you were last year and you're moving in the right direction, great. I mean, when I was growing up in Michigan, this is one of my favorite stories. This is where we're going to come full circle. There was a cute kid that moved to my school when I was 16, 17, and he told me he didn't drink soda pop. And I had never heard of such a creature. And here's this cute kid from Oregon that had just moved to school, and I was picking his brain, trying to like, tell me more, you don't drink pop. You know, I was doing 12 cans of Mountain Dew a day easily, right? Mountain Dew for breakfast, lunch, dinner, snack in between at bedtime. And I had never met someone who didn't drink soda. And so I was super inspired by this new cute kid that just moved to town. And I decided I was going to be healthy too. And so for the next 2 years, I'm not even kidding about this, I walked around so cocky because I was on a health kick. And what that meant to me is when I stopped at the gas station to get my morning Mountain Dew, now I also got a Hostess blueberry filled cake. And I started every day with fruit, right? And like, I was convinced that I was healthy because I had fruit for breakfast every morning. And I believe that was my reality for 2 years, right? And then it took many years later to realize that's probably doesn't count as real fruit, right? And so I would just say any step in that, but that was the first step here. Like where I am now started with me thinking I was doing something right by having a blueberry filled Hostess cupcake, right? And so just keep moving in that direction. Just start with one thing. Just make it so you're not doing any more ice cream. Replace your ice cream with sorbet. Replace your ice cream with coconut bliss. One thing, and once you get good at that, move on to the next thing. And just make every month a little bit better than the month before.
Okay. Well, Dr. Mischley, this was an outstanding presentation. Thank you so much. I know that we all learned a lot. Hopefully we're all going to make some changes in our lifestyle. I'd like to do one more commercial. Remember, you all heard it from Dr. Mischley, how important exercise is, not 2 or 3 days a week. We offer exercise 6 days a week on Zoom, Monday through Saturday. We have it every day except Sunday, 10 a.m. Just go to our website, parkinsonsmi.org. It's free. It's taught by physical therapists, many of them who are on this program tonight. In fact, Jamie Haynes, who's a doctor of physical therapy from Central Michigan, will be a guest presenter tomorrow at 10 o'clock. So please join us for exercise. It's really important. Thank you, Dr. Mischley. I'm going to end so you can go congratulate your son.
Right.
And I hope our paths cross again. So thank you so much.
Yep. Thank you very much. And
Good
have a
night,
nice day,
I was
everyone.
going to say, donate to Michigan Parkinson's.
Thank you.
And tell your legislators to legalize naturopathic medicine in Washington state so that I can move back home someday.
Dr. Mischley, would you be willing to send me the information that we need so that we have a very large constituent base? We represent the entire state of Michigan. And we have 12,000 active people with Parkinson's who participate in our programs that I could reach out to. So can you send me the information?
Yeah, let me figure out where they're at on the legislative process and I will get you that information. That'd be fabulous.
Wonderful. Okay. All right.
Thanks so much.
Bye.
Bye,
Take care,
everyone.
Laurie.
Thank
See you
you.
soon.
Bye. Bye, Norm. Bye, guys.
Bye.
Bye.